17 since yesterday's report. Of course, our thoughts and best wishes and sincere condolences are with each of those families. I can give you some detail. One female and one man in their 60s, three males in their 70s, 4 females and 6 males in their 80s, and 2 males in their 90s. 11 of those 17 deaths are linked to aged care outbreaks. There are some 585 Victorians in hospital, 32 of whom are receiving intensive care, and 21 of those 32 are on a ventilator. A total of 2,091,328 tests have been processed, which is an increase of 20,747 since yesterday. Given the weather yesterday, that's a really impressive number, and I'm so grateful to each and every Victorian who, with even the mildest of symptoms, has come out and got tested. We've just got to keep those test numbers up. Anyone who's got even the mildest symptoms, please come forward and get tested, then isolate at home until you get your results. It's a huge contribution that you can make at a very personal level to our collective fight against this virus. There are 3,920 cases with an unknown source, an increase of 82, so 82 that have been closed out following that coronavirus detective work. That's as of yesterday, or in addition to yesterday, I should say. 536 healthcare workers who are active cases, so those numbers are coming down. Every healthcare worker who gets this virus is obviously a concern to us, and we just take this opportunity. I know there's some amazing coverage in today's newspapers about just how much our nurses and our health workforce more broadly are absolute heroes, and it's only right that they get some small recognition. You can probably never give them enough recognition just to celebrate and to honour the work that they do. So to each and every one of that team, each and every member of that team, and it is a big and diverse team, we're very grateful to you, and each of us as Victorians, in following the rules, in continuing to play our part as the true front line in the fight against this virus, then we can protect those health heroes by seeing less people infected, less people gravely ill, less people in hospital, and less health workers finishing up testing positive for this virus. There are a total of 4,012 active cases in Victoria. The aged care and disability breakdowns will be made available in the show release a bit later on today, but I can update you on a couple of other important matters, and then I've got an equally important announcement to make. Business Support Fund, as you know, we've been providing support to businesses right across the state for many months now. The Business Support Fund has in total approved 126,420 important applications for support. That has delivered $1.3 billion of support to Victorian businesses. Of course, we don't rule out doing more, but that is a very significant direct financial support. Not so much trying to generate customers with so many venues closed, but that's about survival payments in many respects. However, there are some customer-based activity, some purchasing that we can support, and I'll come to that in just a moment. In terms of the coronavirus worker support payment, you'll recall it was $300 for people who don't have sick leave to fall back on when they've got tested and then need to isolate until they get their test results. That was increased just a little while ago to $450, and I can confirm that 24,968 Victorians have received that $450 payment, either $300 or $450 payment. That's a total of $8.89 million, and is, I think, a very well targeted response to so many in our community who are in the midst of completely insecure work, and we don't want them to have to make that choice between feeding their family and protecting public health. That payment is a really important way that we can achieve that outcome, that people can take the time off, still be paid, and not be worse off in a very personal sense, but play a really important part in us tracking and tracing and ultimately defeating this virus. So nearly 25,000 people have received that payment. Just on mask distribution for vulnerable Victorians, as at the end of July, we've distributed some 6.2 million single-use masks to schools, TAFEs, community organisations, all of whom supporting quite often vulnerable Victorians. We've also distributed nearly just short of 1 million, so 981,430 reusable masks, again to community organisations, to schools, to GPs, medical centres and other settings to support vulnerable Victorians who without that may not be able to make or source at their own expense a reusable mask. That effort, I think, is central to the really amazing work that's being done by so many Victorians. All Victorians, I think, really, except a very small number, in wearing masks and playing that important part in driving these numbers down. Now, just before I throw to Brett, we have today, it's important to acknowledge that whilst many businesses are closed and Victorians are not in a position to be able to be out shopping other than for the absolute basics, there are so many outstanding products, so many outstanding small businesses for whom quality is the real key. A quality offering in terms of products and produce, and it's only appropriate that we work as hard as we can to try and direct Victorians to those amazing Victorian businesses. Click for Vic, so an opportunity for a really first-class offering to be in one place or a series of places where Victorians can go online and make some of those purchases. The quality of Victorian produce is well known, very well understood and highly sought, but these restrictions and where we find ourselves is very challenging. But whether it be craft brewing or a whole range of other food, a whole range of other products, there are so many businesses across Victoria that are just absolutely outstanding, and the Click for Vic campaign will mean that every Victorian can play a part in supporting small business and supporting jobs by continuing to buy those first-class products online with the support of both Visit Victoria and the Victorian Government. Can I thank and congratulate all of those who've been involved in putting together, whether it's the Victorian Country Market, Providore, or the CoLab Pantry and many other offerings. I would encourage Victorians to go online and visit these sites. I'm sure you'll find many products that are the envy of the world, and if you can play your part in purchasing some of the things you need with a very local focus, then you're supporting those small businesses, you're supporting not just them but their staff, and you're making it much more likely that they are there on the other side of this second wave. And I think that all assembled today will be pleased to know we have some baskets of wonderful products for you to share in at the end of our media conference. I now will ask Brett to speak to the epidemiology of the day, and then we're happy to take any questions you have.
Thanks, Premier. So the numbers are bouncing around a little bit, but we're not going to see 300s and 400s again in Victoria, not under my watch at least. It would be great to see numbers going down even further, but I still do expect that we're on a trajectory, a 7-day moving average that sees it continue to decrease. But we do have to be doing all of those essential things. They are simple, sometimes they sound really trite to be repeating, but essentially the transmission that's still occurring is sometimes because people have forgotten those really basic but very essential elements. Not washing your hands that one time, forgetting your mask, not wearing it properly, hugging someone who's outside your household. These are simple but also easy to forget. We've got ingrained habits that we're trying to turn around and reinforcing those messages, as was seen in those TV commercials yesterday, are just really important things to amplify that message to as many in the community as possible. And if it can reach just a few more people or make it a bit more habitual for us to do those very simple but really important things, then that's really essential messaging. But we have seen a decrease in our hospitalised cases, down by 25 to 585. The number in intensive care has decreased by 4 to 32, and there are still 21 ICU patients on ventilators. The number of active cases now 4,012, so that's decreased by another 281. I think the true figure of active cases is probably quite a bit less than that. There is a definition for hospitalised patients that requires them to be tested and negative to be cleared as an active case, but that definition's going through a national revision because really not everyone needs to be tested. Even as a hospitalised patient, they will be over their illness in the same way that we count recovered community cases without needing to test them to be cleared. So I think the true active case figure might be more in the 3,500 range, but we'll have that when the national definition for recovered cases is clarified. That's it from me.
Brett has reminded me, referencing yesterday's videos, that we have a short 1 minute video just to again encourage every single Victorian to go and click for Vic, purchase those quite amazing products locally and support small businesses and of course jobs.
While your next road trip might be on hold for now, it's never been easier to bring the farm to your table and the valley to your glass. Just click for Vic. Whether you're in Melbourne or Mallacoota, Victoria's passionate makers and creators are busy bringing our estate to you. From craft work to craft beer, feasts to fashion, the whole state is at your fingertips. So choose Victoria and get behind the people and businesses you love. Click for Vic and get the best of Victoria delivered to your door.
Very good. I'm happy to take any questions you have.
Premier, the transport figures show that a few more people were out last weekend than were the week before, and even the report itself says there's a bit of lockdown fatigue going on. How much
I think,
is that?
well, it's not often that I would stand here and celebrate bad weather, but the bad weather this weekend is an absolute blessing. It really is. If you compare this weekend with last weekend, I'm not surprised that there was more movement last weekend, particularly at such a beautiful day last Saturday. And indeed we saw some pictures, social media, people gathering, people, of course, wanting to get back to normal. But look, as I said yesterday, the only thing that wins if we let our fatigue get the better of us, the only thing that will beat us if we, pretend that this is over because we desperately want it to be over, is of course this virus. It feeds off any complacency, any sense of fatigue, any sense that we're not equal to this task and that we can't stay the course. The only thing that will win out of that is this virus, and we just can't let that happen. That's why I'm so deeply proud and grateful of, I believe, a growing number of Victorians who are doing the right thing. It's the vast, vast majority. The key point here is we've got to get past this second wave and then really push into that even harder period, if you like, where we have to rebuild our businesses, we have to save jobs, create new jobs, and there will be no effort spared by the government and its partners, by business and workers, by everybody. Will be working so hard to re-establish that strength, that nation-leading performance that is the story of the Victorian economy over the last 10 years or so. This is something that we've just got to get through. We've got to get past it. And I know it's incredibly difficult. It really is. But if we let our fatigue get the better of us, the only victor, the only winner out of that will be this virus, because it will spread more easily. And the great tragedy of that is it'll mean that economic repair is further off. It'll mean more people are in hospital, gravely ill, and sadly it'll mean that more people die. So we've just got to stay the course on this. The ultra marathon, that's the best analogy I can think of. We're about halfway, and the strategy's working. To have these last three days with numbers this low, a little bit of an uptick today, but we are confident that because of the amazing work that Victorians are doing, we will get to the other side of this, and then we can begin the really important process, that hopeful process of trying to repair, and I think succeeding in repairing the damage that this pandemic has done.
How hard do you think will this back half of the lockdown be to really get those numbers under 100? I mean, we see numbers fall off quite rapidly, but are you expecting that last little bit to be quite difficult? Yeah,
this is a very stubborn thing, and it won't go away easily. We've brought these numbers down. It's a credit to every Victorian out there, the vast majority of Victorians who are doing the right thing and playing their part. It's also a credit to a massive team, whether it be people doing contact tracing, other people in the public health team, our health heroes we spoke about before. Everyone's working incredibly hard, and I think that it will be challenging these next 2-3 weeks, just because when you start to get down to those smaller numbers, it's It only takes one. It only takes a few bad choices or some bad luck, as it might be, when you're talking about numbers that small. But we've just all got to stay the course on this. There's just no alternative. I wish there was. If giving a speech or passing a law or some other simple thing like that would defeat this, then of course we would do that. That's not where we find ourselves. And when you think about other countries around the world who are dealing with second waves, our strategy is working, and I think we find ourselves in at least as good a position, if not potentially a better one, than many other second wave locations.
Professor Sutton just said that we won't see numbers in the 300s and 400s again on his watch. Are you confident of that as well?
I am, but again, the key point here though is that if we, back to Laurel's point about fatigue, and I get it, I understand it, no one wants these rules to be in place for a moment longer than they need to be, and everyone would like to go back to something approaching normal as fast as possible. But we just have to acknowledge, again, whether we like it or not, we just have to acknowledge this key point. If we start opening up before we have defeated this second wave, then we'll just be in the beginnings of a third wave. That is of no benefit to anybody. That will just mean that people, we might all feel a little bit better for a very short amount of time, and then the numbers will grow, and we'll be back where we are now. We've got to beat this thing and get these numbers down to such a low level that we can keep a lid on them, not just for a week or two, but indeed have them suppressed, have it extinguished to the greatest extent possible, but have it suppressed and with every likelihood that we can maintain those low numbers until, of course, the ultimate vaccine arrives.
What's your message then to those people who are really hanging out for this lockdown to end in 3 weeks? Should they be cautious, or how should they be? Well,
firstly, I'd say to everyone who's playing their part, I'm proud of you. I'm very grateful to you. That's why the strategy's working. But we've got to be guided by these numbers, and our experts will continue to provide us with advice, not based on where we'd all like to be and where our frustration takes us to, as understandable as that is, but on the science, on the data, and on what will make a third wave less likely. That's the key. If we opened up today at around 200 cases, then obviously people would enjoy that for a short period of time. We'd be much closer to normal than we are now, but it wouldn't last long. It would not last very long at all, and then we'd be arguably in a worse situation than we are now. So the key point here, we've just got to, all of us, look out for each other, stay the course, defeat this thing in the second wave, get past the second wave, and then begin the cautious, gradual, and critically important process of opening up and on the part of the government, doing everything we can to repair the damage that this 1 in 100 year event has done to jobs, to businesses, to livelihoods, and to many people's sense of safety, sense of security. We don't underestimate that there are many costs, some economic, some social, many very personal costs, and there's going to be a massive job of repair, but I think we're up to that. I genuinely think we're up to that, and we will stick together. This is a state made up of people who are not only proud, but people who value that sense of community, that sense of working together. I think we can be rightly hopeful about what the next phase will be, but we've just got to get there. And that means we have to remain vigilant, and we just have to stare this thing down. We can't have a situation where any sense of fatigue, our rightful weariness with this thing, means that we basically give into it. Because the only victor out of complacency will be this virus, and we just don't want that.
Health experts have raised concerns that right now we're not really seeing the most in terms of alcohol and drug use and people using not great coping mechanisms. A lot of them are concerned that there's basically, I think they use the word tsunami of people with drug and alcohol issues after opening up. Is your government planning to do anything to broach that area as we come out of lockdown?
Yeah, look, I think if you look at presentations, whether it be, if I broaden out the question a little bit, if you'll let me do that, we've made a number of announcements in relation to mental health. We know that there are a number of people who went into this pandemic with underlying mental health issues, and whether they've been able to get the sort of support that they've needed there's a question there. There's also those for whom this may have, these months may have made their mental illness more acute. And then there will be others who, for the first time, because of the rightful stress and strain, the great pain of these last months, may well be experiencing mental illness for the first time. I think the same can be said in relation to alcohol and drug services. Minister Williams was here just the other day talking about some trends in terms of family violence. Alex, there's a power of work going on in each of those areas, and indeed in more. We see some coverage today in relation to homelessness. There'll be a big job of work to be done, not just in attracting investment to save jobs and to create new ones, but there'll also be a whole range of social services and important programs and supports. To a certain extent, that task was there, one wave or two, but it's obviously a more acute project and one that we'll need to invest in, and we have to this point. But there'll be many more announcements to be made around those issues and those groups of Victorians, and indeed many more.
Death toll's now past Wolves Reach 400, 17 new deaths today. I suppose
Yes.
we get a little bit numb to these figures. How long do you think we'll still see numbers around, 17, 15 a day?
Look, I think Brett went to this yesterday, and I could only make the same point that obviously as the number of people that are in hospital and the number of people that are in intensive care, gravely ill, comes down, then we would hope to see the number of people who lose their life because of this virus come down also. But as you say, none of us should be numb to these things. None of this should not become anything other than a statement of tragedy and an important opportunity, and indeed we're obliged to always have in our thoughts those families who are planning funerals. And whilst in a broad sense we might be a bit more upbeat this week and speaking in terms of a strategy that's working, a bit more positive, we shouldn't lose sight of the fact that there are many families who are at their lowest ebb and they are dealing with the loss of a loved one. And again, I'll make the point that yes, there are many people who have passed away who are in the final stage of their life that they were prior to getting this virus, but there are also many people who are much younger. This doesn't discriminate, and that's why we've all got an investment in making sure that this strategy works.
Yesterday's ad seems like it was quite a success. It's got quite a lot of traction, particularly on Twitter though. There seems to be quite a few haters as well. What are your comments to people who...
I would again thank all of those very proud Victorians who are part of that campaign. And again, I think my views on trying to be respectful in all forums are very well known, and I wouldn't be spending any more of my time talking about social media than that. People need to be respectful in all forums, and I've made that point consistently.
There's been a 13% increase in visits to parks last weekend compared to the weekend before. Now Victorians are able to drive within 5 kilometres to parks. I guess how worried are you about crowding at parks? And compared to the baseline figure, are you able to compare how crowded parks were last weekend to last year this time?
I might have to come back to you on that, Samaya, in relation to comparisons. I think we will have to, in some of those data sets, we'll have a baseline that we can compare back to. I'm not quite sure whether that one, whether we have it there, but I'm more than happy to come back to you. Look, it is not surprising that we had a beautiful, we had absolutely beautiful weather last weekend. And now, just before anyone writes a column saying that I'm blaming the weather, I'm not doing that. I think it's just an obvious thing. We had lots of sunshine last weekend. That meant people were out. This weekend, not much sunshine, and I expect that when we're reporting movement next week, that'll be reflected in those numbers. Again, as enjoyable as it is to get out and about, we can't be focused on one Saturday at the park. We've got to defeat this thing so that people can spend every Saturday at the park. That's the choice we have at the moment. It's about, the notion of fatigue, and I get it, I understand it, but the key point here is that if we don't stay the course, then this virus wins. And I'm determined to make sure that doesn't happen. And I know that the vast majority of Victorians are determined to make sure that doesn't happen. On data, though, and baselines, I'm more than happy to ask that question. And if we can come back to you with some more information, we will.
Just on the business support fund, you said there'd
Yes.
been just over 126,000 applications for support and $1.3 billion paid out.
Correct.
We had some reports last week of businesses who'd been told they'd have to wait until September or October for the payment. Do you have any stats on how many people who've applied have actually received the payment?
So those 126,420, those applications have been paid. If you want me to come back to you on, are there others that are in the system? I hadn't heard that issue around having to wait.
There was a bit of talk back radio
Okay,
on it last
all right.
week.
Let me chase that up for you. So, applied but not approved. So there'll be some that will have been rejected because they weren't eligible, and then there might be some others that are still on the desk, if you like, that are being worked through. I'm happy to. I'll at least ask the question, and if we can come back to you with some more information, we will.
In terms of borders, you flagged that you were talking with some of your interstate colleagues on the border issue on late Friday night. Has there been any movement on the issue?
No further movement that I can report, but I've had some conversations. I think I went to this yesterday. I'm not sure, but I had some conversations with Stephen Marshall yesterday. We've got a process where senior officials are working through, particularly those border communities, and potentially having a bigger bubble, if you like, so moving the South Australian border temporarily into Victoria more. That'll mean that freedom of movement. So there's a whole bunch of those border communities. They're quite small in the main, but they shop and get their food, their fuel, those sorts of things in SA, and it might only be 30 or 40 kilometres to travel. To come back to the nearest place in Victoria is 100 k's, even more. So common sense is guiding that, and I'm pretty confident we're going to get a good outcome there, just as we did on the farmer permit issue. There's a bunch of other issues as well, beyond just border communities and ag workers. Yeah, it was, and I think that is settled. I'm not saying that it's completely fixed and perfect. Nothing really can be, I suppose, when it comes to borders being closed. But we've got a really good process now, and there's a lot of work going on to try and resolve those issues as best you can. I think, Alex, there's always going to be unintended consequences, and there's always going to be a sense of disruption and some difficulties. Of course, we'd love to see the borders open, but I'm not critical of those who've closed their borders, and I'm not. I'm only focused on trying to make those arrangements as best we possibly can.
In relation to the farmer permits, we did speak to some farmers today for our story this evening who have said that they can't wait 2 weeks for a permit. They have their cows that are calving as we speak.
Indeed.
In New South Wales, the cow's not going to be able to cross its legs and not be able to give birth. What are they expected to do? Have you got any hope for them? I mean, they're absolutely devastated.
Yeah, sure. I've got some. I understand that dilemma very, very well, given my own background. What I'd say, we're happy to follow up at any individual cases or any groups of people that have. Ag is a very diverse sector, and there'll be different needs, different pressure points. I know this is calving season, and that is a very significant challenge. Borders closed or not closed, it's a very busy time. I'm happy to try and chase that up. But again, these are not decisions that we've made. They've been made by other governments. I'm not criticising those other governments. We've got open lines of communication. We're working very closely. There'll always be some challenge, no matter how many permits or how much progress we make. There'll always be some challenge, because the purpose of the border being closed is to limit movement. So it will always do that to some extent. On the issue of people wanting to move livestock, not just staff or workers moving, but moving livestock, and the calving example that you give me, I'm more than happy to chase that up.
Just on borders, most states and territories are unlikely to open their borders for a long time, but has New South Wales, for example, given an indication of what their magic number is before they open up the New South Wales-Victoria border?
No. And look, I think it's fair to say, and I'm not here as a commentator, and I'm certainly not here to offer commentary on other states, but if you look at developments in the last few weeks, New South Wales has got some issues that they're working through. I know Queensland, there's some additional restrictions that have come back on there. So everyone's at a different place, but it's not like everywhere else doesn't have things to deal with. Many of them do. So I understand why those borders are shut. I also appreciate how challenging it is. That's why we try and work through as best we can each of those issues. Any of those outcomes will always be, I suppose, an imperfect outcome, because short of getting Stephen or Gladys to open the border, there's always going to be some issues there. But we just try in a methodical way to try and work through all those issues, and I'm really confident, particularly in relation to the South Australian border, where some changes came into effect only a few days ago. I think we'll be able to get a positive outcome there, particularly for those who live right along that border where there are no cases, but there's that critical movement in and out of Victoria to get the things that people need every day.
Have those leaders said to you, for example, we want the ref number at 0.5, for example, or we want case numbers in the low single digit?
No, we've not had a conversation like that. There will be a time somewhere for us to have that chat, but we're still a little way off from that. At the case numbers as they are now, as pleasing as it is to see the strategy working and those numbers coming down, we're still a way off, I think, from being able to make a presentation to other states to say, right, we've beaten this second wave, can you please open your borders now? That's still some way off.
Would it be fair to say, given what's happened not only here with the second wave, but seeing what's happened in New Zealand, Queensland's new outbreak, that your optimism about what we might look like for the end of the year has changed over the last couple of months, that maybe we thought we'd be in a certain place and it's become clear that we're not now?
No, I wouldn't say that. I think that, well, first things first, Christmas is a long way off. As I've said before, a day is like a month with this thing. So, I think that there's every chance that more than that, I think the strategy's working. We are going to defeat this second wave, and then we'll be able to begin the process of opening up. Exactly when that is, we can't give people a definitive date. The exact case number, we can't really provide that either, because we just got to keep pushing as much as we can. But I think that we can. Certainly, my aim is to round out the year with something, a COVID normal. Exactly what that looks like, how that operates, household to household, family to family, different parts of the state, different industries. It's very frustrating that I'm just not able to give people clarity about that, but that's certainly what we're working to, something that's as close to normal as possible. It won't be able to be normal, but finding that COVID normal and making sure that it's, as much as we can, that it is a sustainable thing, so that we're not up and down all the time. We've got the numbers to such a low level that we can sit on. We can sit on it. We can absolutely suppress it and hold it at those low numbers, not just for weeks, but indeed for months.
I guess that's where we thought we were last time, though, isn't it? So I'm just
wondering
if your
again,
that has changed.
No, I don't think so. I think that that's our aim, and I'm confident that there's a big team working to deliver that outcome, and the team includes every single Victorian who's doing the right thing. That's why we're so grateful to them.
For Christmas, I just wanted to ask, would you be considering things like caps on household numbers or gatherings at home?
Look, Dougal, I understand why every Victorian would like. There's probably 1,000 questions that people would like answers to, and I fully appreciate that. But it's too early for us to be going through a catalogue of all the different restrictions as they might or might not apply in 3 or 4 months' time. We just can't, with any certainty. You'd be speculating at best, and it wouldn't even be that really. We've got to be guided by the science. We've got to be guided by the data, and we've just got to keep working as hard as we possibly can to push these numbers down. And then the time will come when we can have a proper discussion, not about what might happen, but what we planned, what we're actually going to do, and what we think it looks like.
The isolation payment, have you received any advice that it's actually working and it is compelling people to stay at home when they shouldn't be wandering off?
I think that if you look at case interviews, if you look at a number of different metrics, not all of which I have in front of me, but I think the fact that 25,000 people, just under 25,000 people have applied for, been eligible for and received that payment, I think it speaks to the fact that insecure work was driving a significant amount of, it was causing pressure, and it was causing at least some, and even one is too many, people to make a decision that their bank balance meant they had to go to work, because if you don't work the shift you don't get paid, and I think that's part of these numbers coming down. A number of people not working, so a number of industries that have been radically changed. As hard as that is, it's a very important part of this. I think it's working. If there's another metric that we can get you to try and validate that, then I'm more than happy to try. I think in terms of exposure days or what people tell us when they do ultimately test positive, and we do that long form interview, that might give us some trends. But I think the mere fact that nearly 25,000 people have applied and received a grant that didn't exist before a couple of months ago, I think that is proof positive that this is working in keeping more, because I take people at face value. I think that if you get the payment and you say you're going to stay home, I think that the absolute vast majority of those people will have done just that, and that is a really important way that we stop the virus spreading.
Just on healthcare workers, are we any closer to knowing how they're getting it and how it's spreading?
Yes, there's, as I've said a few times, and I think Brett went to this yesterday as well, there is a very, very big piece of work going on. Aged care workers, hospital workers, not just clinical, but across the board. And as soon as we can provide you with an update on what that data is telling us, we absolutely will. I think that'll be sometime this week. But it is fair to say it's a good deal more complex than we thought it was going to be, and it's important to get the data analysis right, so that when we're drawing conclusions and making decisions about any changes that we might make, it's based on the very best data.
Isn't it important to get it quickly though too? I mean, we're still seeing new outbreaks in healthcare settings.
Yep.
More healthcare workers isn't it an absolute priority to try to find out how it's spread to stop?
No, I don't think we're in any. There's no difference between the point I'm making and the point you're making. Ultimately, we learn and we use the data we receive every single day, the lived experience every single day, but to get a complete picture across the workforce, which is what we're really talking about in terms of a rigorous data analysis of every infection, trying to work out how each person who tested positive got it, that's a bigger piece of work. But every outbreak gives us learnings and lessons, and I think it wasn't that long ago that I was up here talking about the amount of PPE items that have been shipped out to hospitals. In my discussions with health workers across many different settings, I think people are broadly happy with the amount of PPE, the availability of PPE. It's very challenging to wear it in such density for such long shifts, but it's I think everyone's working as hard as they possibly can, and there is that sense of immediate learning. If there's something to be learnt at the end of any given shift, then I think it gets embedded. It's a slightly different process we're involved in, though. That's much bigger. It's a total picture, if you like. So trying to get a really clear understanding across the board how are these infections happening, and is there anything we can do about that? And that is a good deal more complex than it might seem. But as soon as it's ready, Brett and Alan and others will be here talking all of us through it.
Do you know if there are any healthcare workers who've passed away because of COVID?
I don't believe so.
And of the aged care outbreaks, the deaths related to them, were any of them aged care workers?
I don't believe so. I think they are residents. If there's anything different, we can certainly speak to that in the CHO release.
In terms of aged care, can we have a general update of the trends that we're seeing? Obviously the numbers will come out this afternoon, but generally are you feeling...
yes, the numbers will come out this afternoon. I'm not entirely sure why we haven't got those for you this morning, but we'll get them to you in the next couple of hours. I would say in trend terms, there's some stability that's come to this. If you go back 3-4 weeks ago, we had many more settings that were in absolute crisis. I know there's some reporting today that I think just speaks to the secret to that, and that is all governments working together, all agencies working together, and us all being really focused on making sure that the welfare of residents is the only thing that drives us. So I haven't got a shift number today. I think yesterday I gave you that number. It was up to about roughly 2,400 shifts, I think. So that's nurses going into hospital, nurses going into aged care. That's been critical. But also all the real basics, infection prevention and control, 700, 800 residents that have been moved to other settings. It's been a massive effort. I wouldn't for a moment say that it's over. It's still a big challenge for us, but there is some significant stability that's come to that sector, and you certainly could not have described it in those terms if you went back 3, 4, 5 weeks ago.
We've seen 7 cases linked to a celebrity TV show called The Masked Singer. Is there a reason a reality TV show has been granted an exemption when thousands of other workplaces have been shut down?
I think, well, again, they're not decisions that are necessarily made by me. What I would say though is that there are some, in screen for instance, there are some productions that if they were not to be, if they weren't to continue, then the whole thing would basically fall over and would be lost to Victoria. Again, it's done on a case-by-case basis, and it's always accompanied by a COVID-safe plan. But it just again makes the point. I'm not pleased that it makes the point, but it again makes the point that this is a wildly infectious virus, and even if you've got the very best protocols in place, you will see positive cases. That's why we're not, Rachel, trying to get to 60 days of zero. If we can, that'd be obviously a very good outcome. But our aim here and the strategy is predicated on getting these numbers down to a very low number, a number that can be contained. It doesn't mean that, speaking of Christmas again, the notion that we're going to get to the end of the year and there'll be no cases, no outbreaks. I think there will be still cases. There will be outbreaks. The key point is to keep those to a minimum so that they're within a band where you can have never certainty, but you can have confidence, really clear confidence, that we can track and trace and keep that as contained as possible, and that'll involve all settings.
Just on that point, we had low-digit figures, obviously, around May, June, single-digit figures for a long time.
Yes.
Our contact tracing system inevitably got overwhelmed. How confident are you that the contact tracing system will be able to keep up with demand when we start opening back up again and we have outbreaks?
I'm confident that we've got a very, very big team, and part of the challenge is to manage some of the fatigue there, because it's been a long haul. But I think that we've got our systems and processes in place. If you were to compare, I don't want to be. Yeah, look, I would make the point that if you compare the challenge of 700 or 800 cases on a given day with trying to track and trace a handful of cases, they're different challenges. They're both significant, but I think the latter is exactly where you want to be, and I'm confident that a team that's now 2,600 strong, 1,700 on the phone on any given day, that's a big team, and I think that they're equal to that task. It'll be very much in our hands. It'll be in the hands of every single Victorian. The choices you make when there's a new set of rules, do you follow those new rules? If people do, then that'll make the job of trying to keep those settings in place and the case numbers low. That'll be not easy, but easier than it would otherwise be.
And how has the department improved the contact tracing methods and the processes since May and June, for example? Are you able to give us a breakdown of the changes or the tweaks that have been made?
I can try and come back to you with a few examples, but the thing about it is and this is a very impressive thing. That's why we're so grateful to that big team, to have the task grow like that, but then to have it improve performance at the same time. That's no small thing. And those improvements, and they're not. You don't find 6 hours or 12 hours from doing one thing differently. You often, and that's the grind of the whole thing. You'll find minutes, maybe an hour, and all of that adds up, and there's a cumulative improvement there. If there's a few examples of some of those improvements, I'm more than happy to ask the office to try and chase that up for you.
Just sorry, back on healthcare workers, do you have any idea of 530, I think, active cases? Any idea how many more are furloughed in isolation and what the impact is on some of the hospitals at the moment? You've spoken of them being challenged with, are they actually short-staffed?
Yeah, 536 that are active. I don't have a furloughed number, but if we can provide you with even a range, a sense of that, we will. Look, I think it's fair to say one of Kath's aunties is a nurse down at Frankston Hospital. She was just speaking to Kath this morning. She's just been furloughed. So, it is very challenging, but our health workers are equal to that task. We do have backup staff, but it is very, very challenging. And that's why we're so grateful to so many people who are working overtime. They're working longer hours, covering for others who aren't there. And that's why the message is one of gratitude, one really, we honour the work that those health heroes do. This is a very challenging time, but I'm sure they'll be pleased to see the number of hospital-based infections, so staff infections, coming down. They'll also be very pleased, I'm sure, to see the number of people hospitalised coming down and case numbers coming down. I spoke yesterday or the day before about the first wave where, and this was not a good thing, I want to be clear about that, but we had less and less people going to hospital, perhaps through a sense of anxiety or fear that that was not a good place to go, which meant we had less demand and we didn't have the COVID cases. Now, dead of winter, we've got something much closer to a normal caseload, so a normal number of people presenting to hospital for care, and on top of that, we've got all these COVID cases to deal with. So it's in every sense, these are absolutely unique challenges. They're doing a mighty job, and I'm grateful to all of them. And we backfill, we try and replace as best we can, but it is right to say that there's some strain there, and that's why we work very closely at a hospital by hospital level to try and manage those risks and to support those workers.
So how is that manifesting itself? Are we having to close wards, close sections?
No, I wouldn't say that. Part of the decision, as painful and difficult as it is, to only do Category 1 elective surgery and the most urgent Category 2, so but a fraction of the normal elective surgery work that we would do, that creates space. There will be a whole range of other admissions that are not necessarily surgical, where people there may be an alternative way to go. We'll be managing demand as best we can. And that's probably the key tool, but it is not easy in any way, and that's why it's not just for the courage and the compassion and the care that our health heroes provide every day, but when you think about how they're doing that work under this stress and strain, it makes you very, very proud.
Just on lockdown fatigue again, yesterday we saw lots of people out and about at the markets. I think it was in lay law, not social distancing. Reports as well of university students, some partying on campus together in their own rooms. How concerning are those reports, and where does this leave us if that's happening?
Well, any time we see people making really poor choices and not following the rules is obviously a concern to us, because that compromises bringing these numbers down, and it compromises getting to the other side of this second wave. But I'll again make the point, because I think it's an important one. I don't want the bad choices of a small number of people to detract from the amazing work that the vast majority, and I think a growing number of Victorians, are doing. Big sacrifices, a lot of pain, but people are working with us, and they're looking out for each other, and that's why we're seeing these numbers come down, and that's why we can be confident that we will defeat this second wave. But anyone who makes those really poor choices, it's not the right thing to do. You will get caught, you will get fined, you'll put off, you'll make it harder for us to defeat this second wave, you'll put opening up further off than it should be, and you'll put your health at risk and the health of others. So it's just not smart. Not only is it wrong, and it's not particularly smart either.
From contact tracing, once we hopefully pass this second wave of the pandemic, will you still maintain the size of the contact tracing team all through it?
Yeah, to be honest, I'm not entirely sure. We'll sit down and work out exactly how the virus is presenting. It'll certainly be much bigger than it would normally be, because it'll have that, in some ways, just as big a challenge. It'll be much smaller numbers, but the work and the margin for error will be much lower. We all know one case becomes 50 or 500 pretty quick. So I would think, I can't give you an exact number, but I think that it's the kind of capacity of that team that'll be maintained right the way through until we finish up with the ultimate vaccine.
So you're expecting us to have 2,600?
Yeah, as I said, I can't give you an exact number, Samaya, but I would say the notion that everyone's going to job's done and we'll pack it all away and go to a very small number, I don't think so. I think it's going to be maintained from a capacity point of view for a long time. Now, if a vaccine were to be here in the middle of next year, well then obviously we'd be able to recalibrate that team, and they'd no doubt have a lot of other work to do trying to get everybody administered with one of those vaccines.
Just on that point, can I ask Professor Sutton a
absolutely
question about vaccines? The Australian Medical Association President Omar Horshid said this morning that governments shouldn't compel all Australians to get a vaccine because of the fast-tracked process. Just wanted to get your response on that.
Well, we don't have a vaccine, so I don't think we should be really providing a commentary on any vaccine that's not yet in existence and available for use in Australia. It'll obviously go to the Australian Technical Advisory Group on Immunisation, ATAGI. They'll provide their advice on target groups and the when and the how of vaccination in Australia. But it's up to HPPC to give advice on the broader public health response using a vaccine. And when we have a vaccine, I'll reflect on it with all of my counterparts across Australia and be providing my advice at that time. I certainly don't think we should be jumping in with commentary on a vaccine that's not yet here.
So you don't currently share his views that governments shouldn't compel Australians to get the vaccine because of the fast-tracked process or the fast-tracking of the trial?
No, as I say, we don't have a vaccine to talk about. So I think at the point that we have a vaccine, that's a very valid question. We'll come to it.
Can you bring us up to speed about the cluster that's emerged, or the cases at the Masked Singer? Do you know what happened there?
Well, there are a number of staff in that show who tested positive. They presented and the department's been notified and the show's shut down immediately. But it does speak to the fact that workplaces in particular, because people are not necessarily wearing masks if their work doesn't allow them to have them, and might be in closer proximity because of the nature of the work. That's one of the issues in meatworks. It can be an issue in other industries, and so with a very infectious virus, that's what happens. You get a cluster of cases. There are a number of people who will be in isolation now awaiting test results, and there'll be a number of close contacts who will need to do that 14 days of quarantine as well.
Would this prompt a review of their exemption?
Oh, I think we're always looking at industries in the broadest sense, but I don't think any particular outbreak that occurs in an industry necessarily means that anything's gone wrong. It does relate to the fact that anyone who comes in with a virus can spread it to others in a workplace.
I guess many Victorians would just be surprised that it was even allowed in the first place, given so many people, as Rachel said before, lost their jobs and been
Oh yeah, but the determination's been made around broad sectors that are considered essential, and television is one of those. How the determination's been made for every single show, I'm not sure, but I'm not even sure it's possible to say, this is a program that can go ahead and this one can't go ahead. It will be about the broader, workplace issues with the program.
Do you have the ref number at the moment? An updated ref?
No, I don't have an updated ref number. We'll have one early next week.
Just on the Masked Singer, will that studio need to be shut down for 14 days? What will be the process?
There'll be operational considerations that they'll need to come to. Obviously, it's gone through a clean. There'll be a review of a whole bunch of processes. But for the close contacts who need to quarantine for 14 days, it'll really be around how essential some of those staff are to the program.
In terms of New Zealand, my understanding is that the Americold cluster has grown slightly. Has there been any change? Last time you ruled it out, you said the freight hadn't moved. Has there been any change?
No.
No. Great.
In relation to yesterday's ad, I think you tweeted back saying, "Nice work, Shaz," and then Shaz fainted and was beside herself. Tell us about what you think about the ad.
Oh, look, I think all of these ads, to the extent that they'll reach a new audience, and not everyone will respond to every message, and not everyone will be reached by those messages, but to the extent that they find new audiences or engage people in a different way, and might just have them reminded of some of those essential, but as I say, sometimes very boring messages, to re-engage with those messages in a way that might make them think about it as they're leaving the house, as they're going to work, or as they're interacting with others, then I think it's a great thing.
What gives you confidence that we won't see 300 or 400 cases a day on your watch at the moment?
Look, we're applying a strategy that is driving cases down. It'll continue to drive cases down, and we are not taking our eye off that at any moment. So in the case and contact tracing response, in the outbreak management, in the individual case management, supporting people in their isolation and in their quarantine, all of that work is full steam ahead. And the stage 4 restrictions, as painful as they are just the thing that stops opportunities for transmission, and so we will see numbers down by virtue of that.
So so people can have confidence we're not going to see a third wave with those uptick in numbers.
Oh, as the Premier said, it's not in any one individual's hands. It's not in government's hands alone. It is our collective task to avoid that, and part of it is staying the course through this point in time. There's no question that people want a more normal life now, and that there are so many frustrating and difficult and painful aspects of stage 4 restrictions, but staying the course is the critical thing to do. Go through this period of substantial pain to be on the other side that allows us to have the freedoms that we all crave, really.
400 deaths now is the total that we've got, 17 cases. You touched on this yesterday, but do you have an estimate of when we can really see those numbers those daily deaths start to come down? Is it weeks that we're talking about, or is it days?
I think we'll see a stabilisation in the number of deaths that are occurring, and it may well have plateaued now. I certainly hope it has, because each and every one is tragic. People are losing their parents, they're losing their grandparents, they're losing their great-grandparents. Everyone is affected by every death that's occurring. But I do think it's a long haul. There are many, many people, especially in residential and aged care, who are current cases, who are active cases, and it's a very, very serious illness for those individuals. And so I don't think we'll suddenly see deaths cease. We have to continue to drive numbers down for that very reason, because every single one is an awful occurrence.
Do you have any idea how many of those are from aged care settings?
Overwhelmingly from aged care settings. As you hear the numbers every day, the majority are from aged care settings. It's something like 280 out of the 400 off the top of my head. But I don't have the exact numbers in front of me.
In relation to all those thousands of ventilators that we did order in anticipation for, how bad it could get, do they just sit in storage now, or do we give them to other countries who are dealing with the virus?
Oh, look, it's for the Department of Health and the Minister, Minister Makakos, to make determinations around that. I think as we're still in a global phase where anything is possible, where countries have thought that they've not had a requirement and then had a very substantial requirement, who thought they're through a wave and then that they aren't. There's a long haul to go with this pandemic, and I think there will be no regrets about having an excess ventilator capacity as a contingency measure.
We're halfway through stage 4 today. Our numbers, are they better or worse than you had anticipated before we entered stage 4?
I think we're about on track. I think this is where it was being modelled to be. I'd love it to be even better every day, but I think it's a tough phase. Every phase is a tough phase, but this is a tough phase because there are those complex outbreak settings that are really difficult to turn the transmission around. Then you get the household members of those workers who sometimes get exposed before those workers have become symptomatic, who then become cases, and so it's all tricky, but it is heading in the right direction.
And based on that modelling, where do you expect us to be by September 13?
No really concrete fixed expectations. I certainly hope that we're in double figures. If we're in single figures, I think that would be ambitious, but it'd be great if we're there as well.
Tony Blakely said yesterday he thought it was about 50 to 60 by the end of stage 4. Well, September 13 is
we can place bets. Look, everyone will have their view. In a sense, we don't know what the challenges of the tail are. One thing I do know is that as numbers get lower, we'll have an opportunity to understand those chains of transmission even more fully. We'll be able to do upstream testing for every case to see whether they might have acquired it from, and therefore track more broadly where those chains of transmission might be. Obviously, we're checking on every case on a daily basis, and all those close contacts are being followed up. But if there's an opportunity to do daily check-ins for everyone in isolation and for close contacts, then that might even strengthen all of those elements as well. And so the tail, has lots of dependencies in terms of how we manage the downslope of this curve.
And if those numbers still are in double digits at September 13, would we be expecting to have a few weeks in stage 3 still?
Look, I think we make those decisions close to the time. Again, people want all of that clarity. Me as well. I would love to have that clarity, but we can't second guess what the transmission will be, what the circumstances that we need to look at until we're closer to the date.
And how much closer, as in a few days out of September 13 or a week or two?
Oh, as long as we could possibly give in terms of telegraphing some of the changes that we know need to be made. But the analysis will be ongoing right through, and we'll hopefully have a clearer picture, at least a week out. But you don't know until you're getting close to it as to what the complexities are.
Just an update on some questions in the inquiry last week. There was reports that a person who had taken their own life wasn't found for several days. Have you had any chance to... it wasn't known if it was true or not.
Yeah,
so is there any further investigation?
I was asked that question and I answered as best I could a couple of days ago. That's not something that had ever been brought to my attention. We were aware at the time that somebody had taken their own life, but I'm not in a position to confirm or otherwise that claim. It was obviously a very difficult set of circumstances for that person and for their family and for staff involved as well. But I don't know whether that's an accurate statement or not.
In terms of, apparently there is a number of in the executive of DHS which have been stood down with pay in order to prepare for the inquiry. Have you heard of this?
No, they're not arrangements that would come to me. They'd be arrangements that would be agreed by the secretary of that department, I would think. Or whomever she had delegated that kind of administrative authority to.
And this isn't COVID related, if we're all done with COVID questions.
One more COVID.
Okay.
That's fine.
Last ones, please.
My chances of being able to answer a non-COVID question are very low, but I will try. I will try. Rachel.
Victoria's 6-month limit on our state of emergency expires on September 16. We all hope we'll be out of stage 4 by then, but we'll probably still be in restrictions.
Yes.
What are you going to do to deal with that, given that it will place legal and legislative limitations on what you're able to do?
There's work going on around that very question. I can't provide you with a definitive answer on that, but we're aware of that challenge. And I think the point you make is a very good one, that we will have public health orders, so we'll have directions from the Chief Health Officer of one form or another for quite some time. A vaccine would be really the only thing that might get you to a place where you didn't need making orders of one kind or another. So we'll update you on that once we've resolved those matters.
Just on the Christmas issue, but a little bit closer,
Sure.
Melbourne Cup. Is it going to go ahead as normal, or is there likely?
Yeah, I can't give you an update on that. I'm happy to try and have the racing minister come back to you on footy, on the grand final. I think this week will be the week when some announcements are made around that.
I know
Non-COVID question.
Non-COVID bushfires.
Ah, yes. Actually, I can answer that, yes.
Oh, great, thank you.
Not even knowing what it is, but I can.
We're nearing the season, obviously.
Yep.
How are we preparing in the middle of a pandemic?
Oh, sorry, I thought you were going to ask me about the $110 million that we've just announced for a number of projects, all led by bushfire affected communities. And look, I will take the opportunity just to say that there's a lot of people who are still dealing with the pain and loss of, on some measures, the worst bushfire season we've seen. Obviously, it wasn't in loss of life, but in terms of livelihoods, in terms of all the pain that came from last summer. Those communities are doing an amazing job, and we're honoured to stand with them and support them. And these projects that are all about community recovery and trying to recover and rebuild those communities, it's about $112 million, I think. So it's been driven by that community. In terms of fire preparedness, every season's a challenge. We know that, and just because we had a very thousands and thousands of hectares burnt last summer, that doesn't mean that we'll be immune from another challenge this summer. So there's a lot of work goes on every single day, and I can confirm for Victorians we will be ready, despite the challenges of the global pandemic. We'll be ready to fight fire this summer coming, as we always do.
There are a lot of obviously health complications during the 2019-2020 bushfires. Is the Department of Health equipped to be able to deal with a pandemic, heat-related issues, bushfire-related health complications?
Yeah, our active assumption every year is that the next fire season will be worse than the last one. That's the way you have to plan, whether that's in relation to retardant, fixed wing, rotary wing assets, uniforms, trucks. All of that planning always assumes that the challenge gets bigger every year, and if you're surprised by the fact that it wasn't, well, then that's obviously a good thing. But it'll be challenging for many reasons, not least of which the fact that 2020 is no ordinary year. But I think that our volunteer, career workforce, all those who sit behind them and help plan and obviously support them in their frontline work, they're all working very hard. Some of them are doing COVID work now, and we're grateful to them for that. But yeah, I'm confident that we'll have all the planning in place. But it won't be an easy summer. Not if 2020 goes the way it has been. It'll be a very challenging year, but we'll be ready.
Will that take away from the COVID planning and also the COVID?
No. I think I'm very confident that we can have multiple things planned out at the same time, and that some of that planning work happens now. But of course, that weather is still some way off. But it isn't just fire; it's also heat. There are many people, many communities, and many individuals it'll be challenging for them this coming summer, and we'll be ready to try and to do our very best in each of those challenges. And that goes on despite the fact that the pandemic is presenting enormous challenges to us also.
Challenges, leadership stuff. It's going on for the opposition. It's going on for the government. Will you be leading the party in 2022 to contest the election?
I don't know that. Yes, Alex, I will. This job is a great honour. It is a great privilege, and it's something that I am 100% committed to. There's a lot more that needs to be built. There's a lot more that needs to be done, and I'm honoured to lead a big team, a team that's all about getting the job done. Any other issues? Very good. See you tomorrow.